My name is Arthur Silva. I'm originally from Brazil, grew up in Brazil till I was 9, and then my family moved to Massachusetts at that age. And interestingly enough, the reason why I chose to go into dentistry is because I had never gone to the dentist in Brazil. My family didn't have much money there. And when we came here, we were able to get like medical assistance. I went to the dentist and I had lots of cavities. And the dentist told me that if I didn't start brushing my teeth and taking care of it, I'd end up with dentures. I knew my grandmother had dentures and that was something I did not want. So that really inspired me to go into dentistry, and it's just access to care. With kids not having access to care, I decided to go into pediatric dentistry.
So what's really interesting about our program in terms of emphasis on resident education is that our program is actually solely based on resident education. So our entire division is just based off the residency program, which is really unique to our division. That means that our entire focus is on educating the residents, providing experiences, and doing that while also serving the community through patient care.
So I chose Nemours Children's Health for residency just because of what it had to offer for me. This being a level 1 trauma center, we're able to see a lot of trauma over in the ED and get experience that you most likely probably wouldn't get in a different program. Also being able to see like facial swellings, taking care of that, seeing a lot of medically complex kids was important to me.
So we have an approach at the hospital that has, like I said, as a large specialty care population that allows the residents to have experience with multi-specialty. For example, endocrinology, hem-oncology, cardiac patients. That gives them a experience on how to deal and handle the special care needs of patients that perhaps in different programs they wouldn't have that experience.
The experience that you get is something that you probably wouldn't get somewhere else, being the level 1 trauma center and seeing the medically complex patients that we do see. So I think it really prepares you for private practice, where you're able to see these here, and you might not necessarily see them in private practice, but I think if you're able to see it here, you're going to be prepared for anything there.
My goals for this program and the residents are to be able to send residents out into the community who can care for any child, no matter what their developmental or medical status is. And I think that's very important, especially in areas of the country where there isn't a freestanding children's hospital or a hospital that's able to accommodate those patients with a dental department. So it's very important that the residents are able to manage those patients and know how to appropriately work with the medical team so that all children can have access to care.
The attending to resident ratio is really nice here. There's more attendings than there are residents. So you get a lot of one-on-one. If you want, the attendings will come and actually help you with procedures. They're willing to sit chair side as well, which is really nice, so there's not like so many residents that they have to actually just be working with them.
In a residency candidate, we're looking for a team player, somebody who's very compassionate about patient care, is willing to put in the extra mile in order to serve our families and patients, and has a really desire to treat patients who might not get care in other settings.